Hello and welcome back to another episode of the 2020 podcast, bringing clarity to business, entrepreneurship, and life. I am your host, Dr. Harbir Sian. Thank you so much for joining me. As always, guys, truly appreciate it. Today is, we're recording this on Canadian Thanksgiving, and so I want to say that I'm truly thankful for all my amazing guests and all our amazing supporters and our audience and everybody who shares and likes the podcast. So thank you very much. So much to be thankful for today. So I'm really grateful to be here with an incredible guest, Dr. Kimberly Friedman, who is truly an expert. And, you've heard me talk about dry eye, and I'm trying to build my dry eye practice and trying to integrate different things. Dr. Friedman truly is an expert in the field. She is one of the founders of Moorestown Eye Associates, and she's the director of the Dry Eye Clinic at Moorestown. Her resume is incredibly long with so many achievements. I'm going to list just a few, and then I'm going to let her kind of talk a little bit herself about, who she is and what she does. But she's a diplomate of the American Board of Optometry. She's a fellow of the American Academy of Optometry. She has been on many TV shows to talk about dry eyes and eye health, including the Rachel Ray Show. I'm sure lots of us know what that is. She spends a lot of her time educating, speaking, lecturing around North America. And in fact, I was very fortunate to attend a lecture here in Vancouver, but also in Las Vegas recently, hearing her speak and having the chance to speak with her personally. I'm excited to introduce Dr. Friedman. Thank you, Dr. Friedman, for being here on the podcast to share all of your amazing insights.
Oh, well, thank you so much. That's quite an introduction, but I'm very excited to be here on the 2020 podcast with you. And I got to say, I did not know as much about optometry in Canada as I learned when I was up there in Vancouver with you. And I am just so amazed with all the great things that you've got going on there, and your podcast and your business, and how you're growing and thriving in this dry eye space as well. So it's very exciting. So I kudos to you as well, because I'm very excited to be here. So thank you.
Thank you. That's very kind of you. Thank you so much. One thing I want to start with is I'd like you to tell us a little bit more about yourself, but specifically one thing I know you've said a few times in the few times I've met you is you're a self-proclaimed nerd. And I'd love to know from your perspective, what makes you a nerd and how has that benefited you up until now?
So I was one of those very academic students. I graduated from, at the time, PCO, now part of Salus University in Pennsylvania, very long time ago. I was there in the 80s and early 90s. And, I think that academic background led me through the years to where I am today and wherever I will be tomorrow or the next day. But that kind of tendency to be academic, that tendency to always strive to learn, really led me to what has been the hallmark of my career, which is sort of a constant reinventing of oneself. I think if you're doing the same thing over and over again, year after year after year, it does get a little stale. I mean, it was very exciting for me to do Which Is Better 1 or 2, maybe for the first 5 years of my practice. But after that, I needed to do a little bit more. And the fact that I am a bit of a nerd, and I do read a lot, and I do look at the studies, and I'm always kind of trying to evolve and improve, has led me to different kind of emphasis during my career. And when I first got out, I was definitely doing a lot more pediatrics at that time. Then as I got older and my patients got older and I developed Sjogren's personally, so I started to have dry eye issues, I started to really want to learn more about that. And that led to my diving into a specialty clinic on dry eye. And then my use of the dry eye products and learning more and more about them and different treatment modalities led to where I am now as a vice president of physician recommended nutraceuticals, because I was using nutraceuticals so much as part of my practice. So I guess the nerd in me has served me well. It has allowed me to reinvent and reinvigorate myself in this wonderful career, because we don't have to take a one size fits all approach in optometry, and being a nerd has helped.
Yeah, no kidding. I think that's amazing. I love it. And I also am a self-proclaimed nerd. And I've kind of leaned into that more as I've gotten older, and I've realized that, the benefit of being that kind of, I think, I say nerd, and of course there's this negative connotation around it, but really being that person who's so driven by learning and absorbing information. And then, obviously then you have to apply it, which you've really, really done. Mm-hmm. So let's talk a bit about the dry eye practice. So you started that dry eye practice at Moorestown. I'd love for you to share maybe more from a beginner's perspective then. What if somebody was early stages and they want to build a dry eye practice? A, is there value in it? I know that's a rhetorical question. B, what are kind of the early steps? Not going into too deep into like too many devices and equipment, but what would you recommend a place to start?
Terrific. Well, we all start somewhere, right? I did too. And I say to doctors when I'm talking to them about dry eye all the time, the only thing you need is a slit lamp and your ears. That's it. Now, I have a lot more fancy equipment than that at this point, but I didn't start with that. The patients will tell you if you listen and if you ask the right questions, you can really, discern what's going on with our patients. What's that rule of thumb? Like 80-90% of the time, you already know what the diagnosis is by the time you've done the history. And that's not that different with dry eye disease. So really just paying attention, asking the right questions, and taking a look at the slit lamp, look at the anterior segment, look at the meibum, see what's going on. I mean, that is 99% of the battle. Now, you can get a lot of fancy equipment that can help with patient compliance, that can help with the bottom line of the practice, can help with the treatment modalities and such. But the reality is, to get started, you need a slit lamp and your brain. And that's about it. In terms of how I started and how many people start, I think we do go back to that nerd thing. You do have to go back and learn. You're going to want to read as much as you can read. You're going to want to attend a few, beginner dry eye lectures. It's kind of ironic because now, again, I am a child of, I grew up in the 60s and 70s. So, but when I was working with the New Jersey Society of Optometric Physicians, before I became president, my job or my role with the NJSOP was that I was in charge of developing their continuing education classes. And ironically enough, this would have been roughly in the 90s or so. And the big thing then was, oh God, not another dry eye class. Because at that time, we really didn't have the scope of practice that we have now. So there wasn't as much with therapeutics. There wasn't as much with narcotics. There wasn't as much with some of the advanced lasers and things that we can go and attend these really intense, robust continuing education classes. So back then, it was sort of like, oh God, the only thing they're going to talk about is dry eye and red eyes, and it was considered very superficial fluff that they would give to the optometrist because they couldn't really give us anything with any meat to it. Now, come full circle, all these years later, we realize that dry eye is a heck of a lot more than just here's your boatload of artificial tears, try them all and figure out which one works for you. And now there are dry eye classes that are terrific and really intense and very scientific and will, feed the nerd in you as well as allow you to develop means that would be very successful for your practice. I'll give a shout out to one in particular, but there are plenty. Art Epstein does a series that I think is very good, where it's like a 4-part series that he does through the year quarterly. It's just a webinar. You get continuing education class credit for it as well. But I think it's a nice one because, he starts out with the very basics. Like, this is what you might need to do. This is how I set up the protocol in my office. And then he goes a little deeper, and then he goes into equipment, and then he goes into like those strange outlier cases that are particularly tough. But it's a nice building philosophy. And I know that there's other ones like that as well. So like there's a dry eye university, there's a bunch of them like that. I will say I didn't do that. The way I did it was a lot of self-learning, a lot of reading, but there are some great classes out there that can get you started if you don't have the motivation or the wherewithal to kind of go do it on your own. Those classes are really good.
Yeah, that's awesome. Yeah, I think we're very fortunate now to have so many resources, obviously online, but quality resources like obviously Dr. Epstein is one of the more well-known names, but the Dry Eye University is really great stuff too. And I know they talk more about, they do spend some time talking about the business of it too, not just the clinical, which I think is really important. When we're doing this, we want to help our patients. Of course, we really want to clinically improve the results, but we need to be able to support that side of the business by making some money from it too. I think that's really, really important. So you've already touched on it. I apologize. I forgot to mention it in my intro, which is that you're the vice president of physician recommended nutraceuticals, PRN, which I'm sure many of our colleagues have heard of. And in particular, the talks that I had attended of yours were really more related to omega-3 and the benefits of omega-3. And I have to say, now I knew before your talks that I knew omega-3 was important. And I was telling my patients, okay, you got to look for the EPA, the DHA. But man, after your talk, I've completely changed the way. I even, my office manager even came up to me. She's like, we're selling a lot more omega-3 recently. Like, well, yeah, it's a little bit different the way I talk to my patients now. So thank you for that, Dr. Friedman. And I think we're going to see our patients are noticing a lot of benefits in the near future. But let's dig into that. So if you can, maybe on a broad level, what's the benefit of omega-3 systemically and then for our eye health? And then we'll go a little deeper.
Sure. So I think what happened was going off what we were previously talking about, when I started the dry eye clinic, one of the things that I started to realize was when I looked at the data relative to omega-3 fatty acids is actually even a little more robust than the data that is present on certain drugs that we have available to us. So as with anything, I think we learn as we go. We make our mistakes and we adjust. And when I started working in the dry eye space, truthfully, what I would do is I would often use Restasis at the time. It was before Xiidra Cequa, bring them back in 3 months. And if they were not really feeling better, I would add the omegas. Well, what I learned in time was that I was probably doing it backwards. And I probably should have used omegas as the foundation, as like an inside out treatment first, in order to address the inflammation that's happening systemically and thereby being reflected in the eye as well. And then I would add on the topical. So I kind of flipped my protocol. And when I did that, I started noticing not only was I seeing better results behind the slit lamp, but I was also getting happier patients back. And so overall, what omega-3 fatty acids do in the body in the right form is they reduce inflammation, which of course we now know is the hallmark of dry eye disease. And omega-3 fatty acids, on a broad sense, come in different forms, but the form that works for the eye is the EPA and DHA form, which is the marine-based or the fish-based or shellfish or algae-based omega-3 fatty acids. Unfortunately, the plant-based omega-3s don't really have an effect at the ocular surface and don't really have an effect systemically in the anti-inflammatory way that we once thought they did. And that would be like the ALA, like the flaxseed oil kind of stuff. So we definitely want to avoid those. But in the space of EPA and DHA, and we can get deeper into it later if you want to, but essentially that will have an anti-inflammatory effect in the body, which is beyond just the eye. So when I'm talking to patients about this, I'll say, we're going to start treating this with a systemic inside out approach to dry eye, which is not going to only benefit the eye, but it's also going to have benefits for your overall health, whether it be joint inflammation, whether it be cardiovascular risk for issues there, and skin health. I mean, there's the benefits of omega-3s throughout the body are incredible, and we're just not getting enough in our diet. But I will say, but for our purposes, I'm doing this for your ocular health. You're going to start taking this product. I'll see you in 3 months. We'll reevaluate where you are and then decide if we need to go on. So when I present it that way, the patients are usually very thankful that I'm going with something that in fact has a 90% reduced risk of sudden cardiac death. It's kind of a nice thing. So the fact that I'm making them feel better in their eye is great, but the fact that I'm reducing their cardiac risk as well and other things is a good thing. So overall, the patients are happier because they know that they're getting a more natural systemic benefit as well as an ocular benefit. And honestly, in terms of tear osmolarity, MMP9, and all those little lovely numbers that I measure in my office, they get better as well.
Yeah. And I recall you're saying that in the research, it's shown that the different indicators that we're looking for, omega-3 actually improves more of them than some of the prescription medications that we often will prescribe to our patients.
Yeah, we obviously the omega-3 fatty acids in the right form and dose and all, I mean, they're not drugs. Okay. The nutraceutical industry, not just PRN where I work, but the nutraceutical industry in general, it is an industry, right? It is a business. And when you know that you have a fatty acid like omega-3 fatty acids that can have a reproducible dose indicated benefit to our patients, and a company wants to come out with those, they basically have two choices. Am I going to go the drug route, or am I going to go the nutraceutical route? If I go the drug route, the average cost from inception to out in market for a drug based on a Tufts University study is $2.7 billion, billion with a B. It is incredibly expensive to get through the trials, the FDA process, the regulatory process, let alone then go and get it on the formularies and get it so the prescription drug plans will pay for it without a high coupon, without a high copay or deductible, and then do the coupon game. I mean, we all know it. We deal with it every day, right? The prior authorization game, all that. That game's expensive. $2.7 billion for one little drug to get out there in the market. So we know omega-3 fatty acids play a role in anti-inflammatory in the entire body. And if I decide to go a pharmaceutical route, the way the Cepa, Laveza, those kinds of drugs did, I'm looking at a $2 billion price tag to get there. The other way to do it is with a nutraceutical company. Certainly a price tag to get there, but it's not in the billions, okay? And if you do it with a nutraceutical approach, now the countries are different. In Canada, you can make different claims than you can in the United States. In Canada, you have to prove efficacy in order to get it there. In the United States, you have to put a disclaimer that says this product has not been indicated for the treatment, cure, or prevention of any disease. Like, it's very interesting how the different states and different countries deal with nutraceuticals, but a nutraceutical is not necessarily less effective than a drug. It was just a different business decision on how to get it to market. You do have to, of course, have a nutraceutical company that is using good practices, that is willing to submit their product for lab analysis and show certificate of analysis and things like that. All nutraceutical companies are not created equal, but with a good quality nutraceutical company, PRN is not the only one, they are producing products that, you know, really could make an impact with our patients, just as a drug was or does, but as a different approach. But finally, I would like to add that if, again, going back to nerd again, I keep going back to nerd, but if you look at the studies, Restasis hit the endpoint of Schirmer's. Xiidra hit the endpoint of corneal staining and a dry eye questionnaire that they had developed. Cequa hits the endpoints of, I believe, Schirmer's staining, dry eye questionnaire, and their staining was, I think, conjunctival as well as corneal. Okay. But if we look at an omega-3 fatty acid in an EPA-DHA form in the right form dose ratio, that hits the endpoints of MMP9, tear osmolarity. Corneal staining was improved by over 50% as well. The OSDI was improved by over 17 points. I'm forgetting one, the blood index level. So basically, like, all of the objective and subjective markers that we utilize for dry eye have been shown to be met with a roughly 2 gram, 3-to-1 EPA to DHA, reesterified triglyceride form omega-3 in a blind, randomized, multi-center, placebo-controlled study. So comparing study to study, there's a heck of a lot more endpoints there in the omega-3 box than there are in some of these topical boxes that we use.
That's amazing. When I first heard you say that, I was blown away, actually, because I knew omega-3 was valuable and had a place in my dry eye treatment protocol, but I didn't realize that it was hitting all of those endpoints. And in fact, maybe more so, I didn't realize those other drugs were only hitting 1 or 2, maybe 3. Right. And, you know, because they don't tell you, we didn't hit these other endpoints. They just really zone in or dial in on the one that they did. And so I think that's really important to know that this nutraceutical that can have these other systemic benefits to our health, as well as improving, you know, dry eye symptoms and signs, can help this much compared to right. the medications. And something you touched on, the next thing I wanted to ask you was something you already touched on, right? The form and the dosage and the ratio, really, really important. So I have a lot of my patients that I'm talking to, I'll say, okay, omega-3, you got to be on a good quality. You got to be taking omega-3 daily. We just don't get enough. And most patients say, oh, don't worry, I already take one. Right. Okay. So now, since I heard you talk, I'm like, all right, well, you either got to show me the bottle or take a picture or something. That's what I do. Because you know, well, I'm going to let you talk and then I'm going to give you my side of the story. But if you could tell me about that, the difference in, you know, not all omegas are made equal. What are we looking for in a good quality product?
Yeah. So again, I am the vice president of PRN. Obviously, I'm biased, but when I'm doing like a podcast and things like this, I want to play real with you. I want to not just be an infomercial here. I want you to have the information that you can have to make an impact in your practice bottom line and in your patient's bottom line in terms of their health. So what it comes down to is, regardless of what product you use, form, dose, and ratio. So form, we need it to be in the re-esterified triglyceride form. So there in Canada, I'm pleased to say that most of what is sold in Canada is in the re-esterified triglyceride form. I think Canada has a big head start on the United States in this. In the United States, not so much. Most of what's out there is in an ethyl ester form. To cut to the chase of the two forms, if you were to get an omega-3 fatty acid from your diet, from fish, it would be in a triglyceride form. That is the form that our body can absorb. That is the form that our body can identify and get all the benefits of omega-3s. But when we make an omega-3 supplement, we obviously have to clean the oil that is harvested from fish, because unfortunately we put PCBs and heavy metals and all the lovely stuff in our oceans. So in the process of cleaning the omega-3s from the fish, it biochemically converts them into an ethyl ester. Most of the companies in the United States, and the two pharmaceuticals that I talked about earlier as well, take that ethyl ester form, put it in a capsule, and put it out there in the market. And the problem is that it's not that absorbable in the GI system. Only about a quarter to a third of it actually gets absorbed. The rest of it sits in your stomach, gives you fish burps and indigestion. If you've ever had a patient tell you they were tasting it all day and it was disgusting and they won't take that again, it's because they were on an ethyl ester. That form, really the only way you can get a form like that to work is to megadose it. You got to give them like 4,000 to get 1,000 in, 8,000 to get 2,000 in, roughly, depending. Any of these omega things that I talk about, if you take it on a full stomach, it does absorb a little better than an empty stomach. And that's true if it's ethyl ester or triglyceride. But the ethyl ester is really just not going to be bioavailable enough to make an impact at the ocular surface. So the first thing we remember is the form has to be re-esterified triglyceride. That's basically the same form that is found in nature, only cleaned and then reconverted back into a triglyceride form. It's as close as you can get to nature in a cleaned form. Canada's pretty good with that. United States, not so much. Then we look at dose. So you have to look back again at the studies, right? There are studies that have shown that omega-3s don't work. There are studies that show that omega-3s work like the best thing since sliced bread. That's why omega-3s can be a little confusing in our profession, because there is inconsistent results in some of the studies. But if you actually read the studies, you'll see that there's no inconsistent results at all. The studies that show that it doesn't work, they're generally doing 1,000 milligrams of an ethyl ester. And then 1,000 milligrams of an ethyl ester won't work every day of the week. The studies that show that it does work, they're generally doing 2,000 milligrams or more of a re-esterified triglyceride. So when you look at the data that I was pointing to was a study that was published in Cornea Journal in 2016, which I think to this day is still considered one of the best blind randomized placebo-controlled studies in dry eye on omegas. And it did hit all those endpoints. That study was on roughly 2,200 milligrams of a re-esterified triglyceride. So we know 2,200, roughly 2,000 is what will work. And then the last part is the ratio. And what that study showed is that the EPA to DHA amount was critical to getting these results. So what does that mean? Omega-3s come in, omega-3 supplements, I should say, come in ALA, EPA, and DHA largely. ALA does not work. There are studies that indicate that it actually becomes pro-inflammatory in the body and has a 49% increased risk of macular degeneration. So if you have a patient who's taking a flaxseed oil-based substance, or if you're taking it, please stop. We now know that ALA is not a good source of omega-3s and in fact increases the inflammatory burden in the body. So EPA and DHA is what we're looking for. If it's anti-inflammatory intent, which is obviously what we're using for dry eye, we want more EPA. EPA is more anti-inflammatory. If it is a brain health or retinal health intent, we would like a little more DHA. DHA resides in the cell membranes in the brain and the central nervous system, like the retina, and EPA in more of the peripheral nervous system and the peripheral body. So upshot all is form matters, dose matters, ratio matters. form needs to be re-esterified triglyceride. Dose needs to be above 2,000 milligrams. Ratio needs to be EPA to DHA. In what we use at PRN is a 3-to-1 product. It's the one that's been clinically proven, 3 times as much EPA as DHA for dry eye. So form, dose, and ratio. That's pretty much what you got to remember.
Form dose ratio. Just keep saying it over and over. Form dose ratio.
Well, in America, we just say FDR because FDR was like a president everybody knows. So, you could just go with
That's
FDR.
Actually the first thing that just popped into my head too.
Yeah.
So, it's interesting you say that in Canada, we're doing a little better on that as far as the form, because, okay, so if you could help me then, if it doesn't say triglyceride on the bottle, are we going to safely assume it's not triglyceride form, it's ethyl ester?
Most likely. So when it is a triglyceride form, the manufacturers usually want to tout that. They usually want to sing it from the, rafters or whatever, because it costs more to produce a triglyceride, because it has to go through the normal process that everybody else does. But then there's an additional process on top to reconvert it back into a triglyceride. So when you look at 2 omega-3s sitting on the store shelf in America, one of them might be $17.99 and the other one might be $39.99. And it's like, well, what are you going to buy if you're the consumer? Like, there's a pretty significant price difference between them. So usually the manufacturers will want to put triglyceride on the label to kind of highlight to the informed consumer that this is not the same thing that's in the jug of fish oil at Costco for $1.99. So it'll usually be on the label. One of the other ways you can tell, though, if it's not on the label is an ethyl ester form, the poor quality form, is usually going to have either an enteric coating around it to try to prevent the fish burps, or it's going to have a D-alpha tocopherol preservative in it to prevent it from going rancid. So there are a few other cues that you can take from it, but usually if it's going to be a triglyceride, they're going to tell you.
Right. And that tocopherol, is that vitamin E?
Yeah. So vitamin E gets a little confusing sometimes. So almost all omega-3s are going to have vitamin E in them in some form.
I see.
The difference is that vitamin E, I guess like all omega-3s aren't equal, all vitamin E's aren't equal either. So the full natural form of vitamin E is 8, I guess you could say, subcomponents of tocopherols and tocotrienols combined together. That combination of mixed tocopherols, mixed tocotrienols, that is the nutritionally sound, beneficial vitamin E. And most of your omega-3 products are going to have some form of vitamin E in it, because vitamin E does act as a little bit as a preservative. So it can help maintain the stability. But what some companies do, again, kind of going the cheaper route, they don't use the full form vitamin E. They use just a synthetic form, one part. It's called D-alpha tocopherol. I've seen it written as alpha tocopherol. I've seen it written as DL alpha tocopherol. I've seen it, like, it can be written different ways, but it's usually just the alpha tocopherol one. That is one of 8 subparts of a full vitamin E. If you are seeing only that one of 8 subparts, that D-alpha tocopherol, that is a good clue that it's an ethyl ester. That is also a good clue that that product may have with it a bleeding risk, because you always hear about how they say go off your omegas before you have surgery, or before you have, if you're on Plavix or warfarin or Coumadin, if you're on a blood thinner, you can't be on an omega-3. That's not true. Nobody says don't eat salmon because you're on Plavix, right? You can eat omega-3s when you are on a blood thinner or when you have surgery. But what you can't do is take an omega-3 supplement that has D-alpha tocopherol, because D-alpha tocopherol is a blood thinner. It's the preservative that's the problem, not the actual omega-3. So again, it gets a little convoluted, but if you turn the bottle over and take a look at what it says on the back, it'll tell you what kind of vitamin E is in there. And if it's a full form vitamin E, you're fine. All right. So on this bottle, it says, blah, 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 blah. Let me find it here. Natural mixed tocopherols. Okay. So that means that it has that full mixture of a food-based vitamin E. That's fine. No problem. But when you see that D-alpha tocopherol, that's the synthetic one part thing that has the bleeding risk, and you have to be more careful with that.
That right there, the last few minutes, that was for the nerds out there who really want to know.
Thank you, nerd.
Kind of so I love that stuff. I know that there's at least a few other people out there who like that stuff, because I get people telling me that, like, oh, I didn't know that tiny little detail so that was awesome. That's what Dr. Friedman's all about. So since hearing you speak and since speaking to you, personally, I've been more aware of this. Obviously, I've been looking at the bottles I have at home. Every time I pop into, a drugstore or wherever, I'm like flipping. I literally went to there's a store here called London Drugs, which is, like your Walgreens. And I like turned over every bottle of omega-3 and none of them said triglyceride on them, right? So I was like, okay, so is there something else I'm missing, or would just literally all of them methyl ester? And they were all different prices. They all had different concentrations. Like some were really, really bad as far as the concentration and the, the ratios and whatnot. But so I tell my patients, I'm like, you need to, like, I get it. You've been taking omega-3. I've been taking omega-3 for years, but now I realize that the one that I was taking was not the best. So I've switched, a little while back, I switched anyways, but now I'm more conscious of it. And so I'll tell patients like, look, okay, we sell this one here. Whether you buy this one or not, next time you buy an omega, look for this word. If you don't see that word, don't buy it. Simple as that. So, and I think because they see me being as like transparent as I can about it, they're actually more likely to just buy it from me because they don't want to go through the effort of, sifting through all the bottles. So they just end up buying from us and knowing that we have that better quality product.
Right. Yeah. I will say to them all the time, like, although I hate to use the cliche that you get what you pay for, I'll say in this particular instance, you do. Like there is a difference in quality. They're not all the same. If you have a symptomatic patient, one of the things you can say is, well, if you were taking the right omega-3, you would not be as symptomatic as you are right now. Or if it was working for you, I would not be seeing the meibum look like this, or the meibography look like this, or the dry eye look like this, And so sometimes it takes, depending on the study, somewhere between 2 and 3 months to get a clinical effect from an omega-3 fatty acid approach. So sometimes I'll just even humor me, give me 3 months, take the good stuff for 3 months. Let's see what happens. And if you don't see a difference, I'm not going to argue with you anymore, but they always see a difference. So, but like if I can get them to just switch for 3 months, I know that they will experience the difference and be okay. But it is, we are skeptical by nature. There is a bigger price tag associated with the better omega-3s. And, if the doctor is selling it in their office, people will naturally get a little bit more skeptical. But, the reality is that the proof is in the clinical studies and the proof is in the patients when they come back in your office. And just like doctors don't have any trouble talking to the patients about why a daily contact lens is better than a monthly contact lens or a yearly contact lens, or why, an anti-glare coating from company X is better than the, cheapy $15 one that they get it online. We don't have a problem saying that. Why do we have a problem explaining that Nutraceutical A from Costco is not going to make a difference, but Nutraceutical B in a good quality form, dose and ratio will make a difference? Like we just have to stop getting in our own way. We don't have a problem prescribing Tobradex. Why do we have a problem prescribing an omega-3 when it works just as well and it's got just as much clinical data?
Yeah, I think that's so key. I think you're right. We do tend to get in our own way when it comes to that. I don't know why we do it. I was guilty of this for so long too. Is like, I just assume a patient they don't want to pay that much. I'm just not going to, and you're afraid of bringing it up with them. But it's a more, give them the information, give them, your knowledge, and then let them make the decision after that. And actually, on the note of prescribing, something that we started doing, I think last year maybe, is I actually have these little prescription pad things that say on them, hot compress and artificial tears and omega-3, and I'll fill in the blanks with what brand or whatever product specifically, and I'll tear it off the little pad and hand it to the patient. I feel like that has a little bit of an effect on them psychologically of like, okay, this is something I need to do as a prescription.
Right.
Helpful for us.
I have that too. In my office, I have this like dry eye folder, and it just has like a checkoff sheet in the beginning where it's like, okay, we're going to do this, this, this. And then, and it just kind of shows them like, and I also like it because they can see that there's other things. Like I may have given them, in your case, the checkoff pad. Maybe you gave them 2 or 3 checkoffs on that pad, but there's 3 or 4 other things listed there that you did not check off for them. And psychologically, what that does is that they know that, okay, if I'm not feeling better in 3 months, or if I'm not feeling better in 6 months, I don't need to go doctor shop and find another doctor. I saw this thing that he gave me and he wasn't giving me the full paraphernalia yet. There's more things we could do. So if I'm still having a problem, I'm going to go back and talk to him a little bit more, so it kind of shows them that there's plenty we can do. We're going to start simple. and then we'll build up if we have to, but I'm not going to throw the kitchen sink at you if you don't need it yet, so
That's
I
good.
like those
I didn't
kinds of
think about that, but that makes sense, right? Because we have a bunch of other stuff listed on there, and I'm rarely ever checking all of the stuff off.
right. It's
I
just
didn't-
reinforcing to them that this is our starting point. I think this is going to work on you. Like with there was a study that was done with a particular doctor out of Will's Eye who showed that in his case, 70% of patients, dry eye patients, with just the omega-3 approach were asymptomatic after, in his case, it was an 8-week study. Now, in my office, I don't think that that's real. And really what I see, I have pretty hard patients. A lot of them have rheumatology conditions, comorbidities and stuff. So, but I would say half of them are okay on just the omega-3 and an occasional artificial tear approach, or the omega-3 with maybe a breakthrough Lotamax here and there on a bad flare-up, week or something. So a lot of my patients are controlled well with just the nutraceutical approach with some little bit of stuff with it. But the other half are not. The other half, I certainly am writing my share of Restasis and Xiidra and Cequa. I'm on Restasis personally, so I'm not anti these drugs at all. I think they work great. But when the patient sees like this is where we're going to start, and I even say to them, there's tons of things we can do with this to make you feel better. And it took you many, many years to get to this point. It's going to take me a few months to figure out what the right cocktail is for you. But we're going to start simple, because if I throw everything at you off the top, it's going to cost you a lot of money and a lot of rigmarole and a lot of maintenance. Maybe you only needed one thing. So we're going to start with this. I'm going to see you back in 3 months. We'll see how you are. If you're like the study, 70% of patients, we're done. Mm-hmm. But if you're like the 30%ers, we're going to need to do more. Let's see where you are. And then we'll go from there.
That's pretty remarkable. Even if it's 50%, that right. Omega-3 just fixes that half of the people that are walking in the door is crazy. So that definitely has changed. Again, this enough that my staff was noticing that we were going through the Omega a lot faster than we were just a few weeks ago. So,
right.
So, I'm hoping to see those people back in a few months and hoping to hear a lot of positive things. Mm-hmm. So a lot of what you do now, I think you kind of referred to it earlier or alluded to it earlier, that you spend less time in clinically now. You do a lot of stuff outside of the clinic, whether it's speaking or PRN. I'd love for you to share, if you could, for any young ODs or any ODs out there who may be looking for opportunities outside of the clinic. And I feel like I hear that conversation a lot more. There's a bit more of this sort of entrepreneurial spirit floating around, right? Which I love. Mm-hmm. And I'd love for you if you could share kind of any pointers or tips or whatever for somebody looking to kind of do those types of things.
Yeah, it's funny. I don't remember those conversations taking place like in the early 90s when I got out of school. It was really, you were going to practice as an optometrist, with patients, and that other aspect I didn't hear as much about. And now certainly that is a big part of what a lot of us as optometrists do as well. Not that the patient care is critically important, and we all love that. And that's why we got into this, but it doesn't mean that we can't have an entrepreneurial spirit and look into other aspects. The people that I see doing well in branching into other worlds outside of just patient care, I think it comes down to a lot of the same old stuff that is true at any stage of life. It's a lot of networking. It's a lot of getting out there and getting to know people, attending the conferences, attending the, stopping by the booths, introducing yourself, making sure that the products that you personally use regularly in your office, you're the best person to speak about those products. That's how I got involved with PRN. I honestly did not set out to be doing what I'm doing right now. I was fairly content to just ride out my life as the co-owner of a 4-doctor optometric practice, run the dry eye clinic. The office does very well financially. I was happy. And what happened is, in my case, the corporate world came calling to me. They came to me and they said, you're going through a lot of omega-3 fatty acids, more so than your colleagues are at a greater rate. What are you doing? What are you saying? Why is it so successful in your office? And I honestly started with them just being a consultant, teaching doctors what I was doing, just teaching doctors, like, this is what I say. And this is what I say if the patient comes back with this, and this is why I think it works. And then that led to me doing more speaking engagements for them. And then that led to me teaching their sales force what I was doing and saying, so that they could go out and say it to the doctors, and then that ultimately led to me being a director with the company and then a vice president of the company. So it was about a 4-year process from somebody, really a lowly account manager in my office, saying, boy, you really use this. Do you mind if I give your name to my superior? I think we could go somewhere with this. And then going up the ladder that way. But since then, I have noticed that, I am on the speaker bureau for 3 or 4 different corporate entities right now. And a lot of times it starts at the local level. It starts with the local rep coming into your office and just saying to them, I'm really impressed with your product. I've been really happy with this product. If there's ever an opportunity where you want somebody to give a testimonial or you want somebody to speak about this product, I'd be all in. I'm really comfortable with this. I really like it. And I've seen some of the colleagues in my office get speaking engagements and things like that from that. So honestly, a lot of times it's just networking and being able and willing to put yourself out there and say, I'm interested in doing this. I was on the advisory board for Women in Optometry magazine for a while. And again, it was the same thing. It was just, I met somebody at a conference and we just got to talking and they're like, would you be interested in doing this? And it builds slowly and organically over time. It's like anything else. Don't be afraid of a little self-promotion. Don't be afraid of going out there and meeting. But if you're sitting in your room taking virtual CE classes, and I know COVID was different, okay, but as things get back into in-person meetings and such, that's where the connections are going to be made. And I do think, I'm about to totally segue here, but I do think that we lost a little bit of that personal connection, that colleague connection, and that interpersonal relationships and networking when we did have to sit behind a screen and talk all the time. And as things slowly open up and as your comfort level improves, getting out there and getting to know the reps and the regional directors is really how you can move into other areas in optometry.
Yeah. Absolutely. 100%.
I mean, you do it too. How do you do it? I've seen you do it. You work a room like nobody else, my dear.
Well,
so how do you do it?
Thank you. That's kind of, that's taken practice. I don't know if I do it better than others, but getting comfortable to go around and talk to people is definitely something that takes practice. But 100% agree with everything that you just said. And in fact, that's similar to the answer that I give a lot of people, as well as the networking side of things, getting involved with the association. So I think I give a lot of the credit for opportunities that come my way, I say, are started with me being involved in our provincial association, being part of committees, attending meetings, the conferences, and yeah, it is a little bit of schmoozing, I suppose, for lack of a better term. But something that I talk a lot about is, or I did actually up until a little while ago, was branding, right? As being a personal brand. We all, if you're in, everybody has their own brand, and whether you think about it that way or not, whether you're a doctor who sits in the office and sees your patients and goes straight home and doesn't do anything else, well, whatever your patients think of you, that's your brand. But now if you want to be the person who's out there speaking, now you have to expand your brand to be something that industry will recognize as something that they want to present to their customers, right? So when you're out there talking, think about who you are and why that company or whoever might want you to speak on their behalf. And one of them, obviously, is you sell a lot of their product. That's one thing that's going to get their attention, but perhaps you have other qualities and you have to let them be known. And like you said, never be afraid of a little self-promotion. You have to let people know that you're interested. Otherwise, they'll just say, "Oh, that's a really nice person who sells a lot of our product, but they don't seem interested in speaking, so I'm going to go to the next." Right. And I did plant a lot of those little seeds as well. I continue to, when I can, say, "Oh, well, if there's an opportunity, let me know." So I echo a lot of the same things that you just mentioned.
I think that I underestimate the value of those getting involved with the state or the provincial association. I mean, the truth is that probably even long before I started utilizing PRN products in my office and became a big user of them and started working with account managers, that probably is what put me on the path towards alternate careers, like literally right out of school. Like one of the problems that our profession has right now is that for whatever reason, a lot of the optometric organizations have trouble getting new blood in. It can sometimes be perceived as a woman, it can sometimes be perceived as the old boys club, the good old boys club, and it's hard to break through. Or if it's not even a male female thing, just almost an age thing where like you, as a younger doctor, you feel like you're the only one in the room that doesn't quite fit in. And you do have to be confident enough and strong enough to work through that and get a seat at the table and show up. Because the truth is, your local organization, your state organization, your provincial organization, your national organization, they're all volunteers. They're no different than you. And the only difference is that they agreed to show up at a meeting. They agreed when somebody said to them, would you be willing to come and attend this committee meeting? They said yes. And granted, it's, you're volunteering. It takes a lot. I cannot tell you. I mean, I can tell you that the 2 years that I was president of the state organization, which would be equivalent to the provincial, I guess, in Canada. I mean, I took an income hit. You're traveling all over the place. You are lecturing all the time, and you're doing this. You're volunteering. You're flying, in our case, to the national organization in St. Louis. Like, yeah, it is a dedication. But on the end, you end up being able to have incredible connections, incredible network of people that you know, and you can then move into some of these entrepreneurial and they don't even have to be corporate, but all kinds of different areas. So it's a short-term investment in your career and in the future of your career that ultimately leads to a long-term personal investment in yourself too. So to me, it's the best of both worlds.
Absolutely. Absolutely. That's awesome. Thank you for sharing that. On a similar note, and kind of alluded to it there again in your answer, but when I have successful women on the podcast, I've had lots and, amazing from different industries, athletes, Olympians, even, I'd really like to have them share their path. And if there have been obstacles as a woman, to get to where you are, and if you're able to share some of your insights, perhaps for younger ODs or other women in other professions who are trying to kind of build their way up.
Yeah, it's, I'm hoping that it would be different for a younger female OD graduating today than it was back in 1991 when I graduated there. And honestly, in 91, it wasn't that bad compared to maybe the women that graduated, 20 years before me. I do think that we are seeing improvement in this area. So that is very positive. That being said, there were plenty of times I walked in the room where it was like, well, when's the doctor coming in? Or are you the nurse? Could you send the doctor? I have had patients refuse to see me because I was female, but that was a long time ago. And honestly, now there's more patients that will refuse to see my male colleagues because they want the female, so I do think at this point it can kind of go both ways, but there were definitely times where it would come up. I was the first female president of the New Jersey Society. At the time, that was like a big deal. Now I think there's been 5 or 6 or 7 since me. So it's not that big of a deal anymore. So I think we've definitely seen change there. That being said, it will still happen at times. I do think that we need to understand that when something has been a certain demographic has dominated a profession for a long time, change comes and it does come, but it takes a little time. You will still bump up against that occasional person who hasn't kept up with the time, so to speak. But I think that I've been pretty fortunate that I've surrounded myself with both strong men and women that have been inclusive, that have invited me to the table. And on those few times, you just have to kind of think of it as feeling more sorry for that person that they think that way because they're shutting themselves out of 50% of the great people in the profession. So
that's amazing. That takes strength though, and courage and confidence to think that way, I think, versus the other way of potentially shutting down and thinking, well, that person has taken this opportunity away from me or whatever. And so that, that's a lot of credit to you and other women who do continue to work through that. And, huge kudos to you for being the first woman president of the New Jersey Society. That's really incredible. So you paved the path for all the women that came after you. So good for you.
It's fun. I enjoyed it. I really did enjoy it. And honestly, again, going back to networking and things like that, the way that happened was when I was in college. I literally was working for the NJSOP as an intern. And so I got to know them. And then when I got out of optometry school, I started volunteering for committees. And, so it's, a lot of this stuff starts a long time ago, and they start in these little subtle ways that you don't realize are going to balloon into something else down the road. So you just have to learn to say yes to some of the opportunities that present themselves because you don't know where they're going to end up. So,
I love that.
you know, being willing to walk through those doors that open, that's a lot of it, you know?
That's amazing. And actually one of my favorite quotes, so again, if anybody's following me on social media and podcast stuff, that I'm very I love philosophy, I love quotes and things like that. And one of maybe my absolute favorite quote, it's a long one, but the premise of it is, the core of it is going for taking charge of an opportunity is kind of the key. Being bold and moving forward is the key to everything, because once you do that, you don't actually realize what all these other opportunities that may present themselves. Right. You may be acting on this one thing that's right in front of your face, but once you take that step, all of a sudden there's a bunch of stuff behind that door that you didn't even know existed.
Right.
And I've definitely had that personal experience many times. So I always encourage people to do that.
Yeah. And the flip of it is, as a woman and as a man, you also have to know when to say no, right? Because right now, my problem is I'm overscheduled, right? You know, so it's like you have to take the opportunities as they present themselves, but also have that. I'm a yoga teacher. So in my yoga world, I do believe that our gut instinct, that internal awareness that we all have, that we tend to just shut off and go, oh, that's crazy thought, or, oh, that's just coincidence, or what am I thinking? I think we all need to learn to tune in to that inner voice, to that inner gut instinct, because it generally won't lead you wrong. And if your gut instinct is, oh, I would love to do this, but ... then just, you would love to do it, go do it. But if your gut instinct is, oh, I don't know, something just feels wrong about this, then don't do it. Don't allow yourself to kind of be put in a position that you're not comfortable with, and allow yourself the privilege, the honor, grant yourself the potential for joy and opportunities by taking them when they come, and just kind of tell that inner voice to shut up if it's telling you can't do it. Listen to your gut instinct. You probably can.
Yeah, that's amazing. Thank you for that insight. And the fact that you're also a yoga instructor on top of everything else you do, that's pretty cool. Yeah. Very, very cool. So, Dr. Friedman, we're getting closer to wrapping up here. And I always ask 2 questions of all my guests at the end of the podcast. So I want to pose those to you now. The first one is, if we could hop in a time machine and head back in time to a point where it was a difficult time for you, feel free to share that moment if you'd like. But more importantly, what advice would you give yourself at that time?
Oh, wow, that's really good. And you know what, the first thing, again, yoga teacher, first thing that popped in my head, that's the one I got to go with. I'm not going to censor it. In 2014, I had Legionnaire's disease. I was really sick, really, really, really sick. And I was out of work for about 6 months.
Wow.
And I got to this point where I was too sick to work, but I was not so sick that I was just lying in bed, half unconscious and not knowing what was going on. So I was bored out of my freaking mind. And I was really, really depressed and it was bad just because I was so sick and I couldn't do anything and I felt useless. That's when I created my dry eye clinic. That is, because I was sitting in bed, I could not work, but my brain was awake, but the rest of my body was not awake. And I started conceiving of everything, just like you would do with what you do. I created the logo, I created the look, I figured out the scheduling protocol, what equipment I was going to buy right away. That 6-month break from life basically allowed me to decide what my next reinvention was going to be. And it allowed me to create the dry eye clinic at Moorestown Eye, which then allowed me to start to utilize products that I had not done before, which then introduced me to PRN, which then introduced me to consulting, which then introduced me to what my full-time job is now. And I love it. So that was a really low point in life. I was really sick. I was really scared. It ended up giving me the break from my previous kind of normal day-to-day to recreate what is now a better life.
That's amazing. That's amazing to take that opportunity and create something else from it is incredible. The final question that I'd like to ask you then is, everything that you've accomplished to this point in your life, how much of it would you say is due to luck and how much is due to hard work?
Ooh, that's a good one. All right. So I think we create our own luck. I think that we're all given opportunities and we choose whether to take them or not take them. And sometimes I think luck and happiness are not things that are necessarily granted to you by the universe. I think that those are things that we create internally. I think that we can draw luck to us. I think we can draw happiness to us. I think that those are decisions that we make, and that we tend to unempower ourselves, if that's a word, to think that these things are either granted to us or not granted to us. Like there's some grand wisdom out there that, okay, I'm going to give you luck today and I'm not going to give you luck today, or I'm going to grant you happiness today, or I'm not. I think I think that happiness is something that comes from the inside out. I think it's something that we create for each other and create for ourselves. So how much was luck and how much was work? I think that it was life. I don't know that it was necessarily work. I think it's attitude. I think it's what you believe. I think it's how you understand how life works. I'm getting very yogic right now. Forgive me. But I think that it has more to do with what you create for yourself. And I don't consider that work. So the answer is, it's not luck, it's work, but it's not really work. It's the choice awesome. You choose to make.
I love it. That's fantastic. Of course, I asked the question in that very polar way, right? There's one or the other, but I love guests go off the board and give that kind of feedback. And I love the yogic kind of philosophical angle. That really resonates with me too. Right. So thank you for that very thoughtful answer. I appreciate it. So that's everything for today's podcast. I do actually have a bunch of other questions for you, but we're just going to have to save them for another time. So thank you for taking the time, because I know you're super busy. Thank you so much. Are there any other? Oh, sorry. I guess there's a couple more questions. One is, where can people find you?
So if you have any questions about anything, easiest thing to do would probably be to just shoot me an email. It's K Friedman, Friedman at prnomegahealth.com. Or you can even just go to PRN Omega Health. Look, right here, PRN Omega Health. Wasn't that a good infomercial? PRN Omega Health. But you can just go to PRN Omega Health and click on the contact, and it'll eventually get to me after it goes to them. So that's the easiest way, probably. Or you can even do it on my website for my office. And if you want to learn, feel free to steal stuff from my website. Not that it's the best thing in the world, but, feel free to look at the dry eye clinic stuff on my website. That's moorestowneye.com. And Moorestown is MOORESTOWNEYE.com. And you can click on that and that'll get to me too. So whatever works best.
That's amazing. And then you do have, there's lots of good content there for sure on the website. And any final words of wisdom that you'd like to impart before we wrap up?
I think just thank you so much. Thank you for your time. And for those who are listening that work in optometry, you are in one of the best professions in the world. Do not let the naysayers kind of get to you. Don't let them in. People create their own happiness. Some people are happy when they're complaining. Don't worry about that. This is really, I have had such an incredible life as a result of the profession that I chose for myself. And I would choose it again any moment of the day, anytime. And again, there's so many opportunities within this profession for how you would like to practice. So enjoy them all, explore them all. You don't have to define yourself as one way. Get rid of the little box of the definition of who you are, and take the opportunity to explore all the possibilities in optometry. It's a great place.
And that means a lot coming from the founder of a practice and the creator of the Dry Eye Clinic, and who speaks and lectures and is also a yoga instructor. I think that that's your living proof that can be done, and that we don't need to put ourselves in a little box. So thank you.
Either that, or I have career ADD and I can't make up my mind, so I just keep one or the other. I don't know.
It doesn't matter. As long as you're happy and you're doing good work, it doesn't matter. So that's awesome. Thank you so much, Dr. Friedman. Thank you, everybody who's listening and watching. I'm sure there was so much great value that you could take away from what Dr. Friedman shared today. If you did find some value, please do share it. Take a screenshot, throw it up on Instagram, wherever you like. Hit like and review and comment and all the good stuff. I always forget what you're supposed to do to anything that seems like a positive thing to help the podcast grow. I really appreciate it. Thank you all so much, and I'll be back with another episode very soon.